Hi, my name's Janice Hewitt. I'm your Chief Accountable Officer for Health and Social Care Integration. As many of you know, Health and Social Care Integration comes into being on the 1st of April 2016. So for the last year and a half we've been gearing up to get all the governance in place to make an effective transition into health and social care. So what is health and social care? It's about bringing the functions of social work together with some of the healthcare functions and making sure we avoid duplication, we get better outcomes for people and we get a more effective service. I carry about with me a little stone that says purpose on it, and it's a timely reminder about why we are doing health and social care integration. For me, it's about making people's lives safer, healthier, as independent as possible, and that's really important. So our main purpose is safer, healthier, independent lives. And I want us to really grasp that. We've got quite a transformational opportunity here as we bring health and social care together. We want to redesign services and improve services so that they're safe, they're effective, but they are very much person-centred. I'm here today in the integrated daycare service, and we've got really good practice. You as staff members have worked for many years on joint work and integrated work, so we want to build more of that. However, we have challenges. We have to make sure it's safe. We have to make sure that we're on target, and we actually have to make sure that we're in budget. Very, very challenging. We will make sure that our driver is that people are supported in the right place at the right time. Even today with daycare services, we need to ensure that people get the right opportunities presented to them. We need to make sure that carers know and understand the information, and we've got a website that's coming on board. We've got Making Life Easier website where people can access information so they know where the right support is. And it's up to you as our staff members to make sure that carers, family members and service users know that that information is available. We've got a number of priorities ahead of us. We want to address inequalities. It's so important that we get in at an early stage. Many of you will have heard information coming through about tax on fizzy drinks and a whole variety of things in order that we can tackle lifetime debilitating conditions like obesity, and they have a huge impact on the health service. But inequalities is more than just long-term conditions. It's about addressing poverty, it's about looking at opportunities for access to services. So we need to start with young people, we need to start with children, giving them the best start in life. We've got prevention and early intervention, and it's incumbent on you to make sure that we prevent as many health conditions as possible, and we intervene at an early stage. We need to be person-centred, and again, most of you have joined these careers in health and social work or various disciplines because you believe that people deserve the best. So as we're planning services, can we make sure that you make sure that they're person-centred? They have to be safe and they have to be of good quality, and that's important because that's about your professional practice as well as keeping an eye out for other areas where we think safety might be compromised. So adult protection, child protection, clinical governance, they're all important. So again, we need to make sure that you get the right support as staff members around your clinical practice as well. We need to maximise all our assets. Sometimes these are buildings, sometimes that's money, sometimes that's learning and development opportunities. So we need to maximise them as well. But more importantly, we need to make the whole system work. This is as much about stopping people going into hospital who don't need to go in. This is as much about caring for people who are in hospital. But equally, we want to get people out of hospital quickly and back into their localities. There are lots of opportunities that we can improve service around end-of-life care or equipment and adaptation to keep people at home. So we need to make the whole system work. So this isn't about separating off elements of social work and community health practice. This is about making the whole system work, and we're very much working in partnership with the council and with the health board to look at the whole system. Some of you will have been surprised about the amount and number of functions that have been devolved into health and social care. Please take time to look at all the different functions. There's a variety of them, and you'll see in the leaflets you'll be given a variety of paperwork that show the functions. Surprisingly, the Joint Integration Board has to plan for all of these functions. They'll then be operationalised, and you will be asked on behalf of the council or behalf of the health board to deliver those services. And sometimes those services will be delivered across North and South Lanarkshire. But there's a whole variety of functions that you need to deliver for us. But we equally need your creativity and your innovation and some new ideas, because we don't have enough money, we don't have enough assets to keep going in the same way as we always have done. So I'm really relying on you as staff to come up with creative ideas. So finally, what will success look like? Well, success could be described in many different ways, but I've tried to put down some indicators of success, and you can look at them and reflect on them. But we would love people in North Lanarkshire to be supported at home for as long as possible. We want people to become healthier as part of our early intervention. We want children to be given the best start in life. We want people to be less reliant on services and look after themselves for as long as possible. We want good early preventative measures, and we want localities to be able to provide the support they can, and that's what success will look like. But equally, we want to look at good outcomes for those in the criminal justice system, those who are going through difficult experiences in the mental health system. So all of that will sum up success for us. But more importantly, what will success feel like for you as one of our members of staff? I go back to our purpose. What is our purpose? Our purpose is to make sure that people in North Lanarkshire have safer, healthier, independent lives. So safe, on target and in budget. It's not too difficult, and I hope you can help as we go forward. So integration is upon us. Please ask any questions that you feel you want to. Please write them down, email us. Make sure that the management team who will plan all of these services know your ideas and opportunities. Thank you for listening. Please be an active part of health and social care integration as we go forward. We're here to support the people of North Lanarkshire, so make sure you remember the purpose. Thank you.